Well, many hid their status because of the fear of stigmatization. It became the new normal, impacting the global economy in diverse ways. Well, now, the World Health Organization has declared that COVID-19 no longer represents a global health emergency, representing a major step towards ending the pandemic 3 years after its first declaration. In the following report, we bring you the latest of the disease in Ghana and what the announcement by the WHO means to the fight.
It's therefore with great hope that I declare COVID-19 over as a global health emergency.
It began 3 years ago when COVID-19 was officially declared a pandemic by the World Health Organization.
WHO has been assessing this outbreak that COVID-19 can be characterized as a pandemic.
Globally, there have been more than 765 million confirmed COVID-19 cases since the start of the pandemic, according to the WHO, with Europe recording the most cases. According to the WHO, there were likely at least 20 million COVID-19 deaths, far more than the officially reported 7 million. The virus is still killing hundreds of people worldwide. Ghana recorded its first 2 cases of COVID-19 on March 12, 2020. President Akufo-Addo closed down all schools across the country on March 16, followed by a lockdown restriction in Greater Accra and Greater Kumasi, the hotspots of the virus in Ghana. For 10 months, students and teachers were left in limbo, not knowing their fate and/or what the future holds. Events such as funerals, marriage and naming ceremonies, religious activities and many others were all impacted. Citizens dreaded the weekly update by President Akufo-Addo, which always began with the now popular phrase, "Fellow Ghanaians." Despite the many interventions, many gaps were identified in Ghana's health system, as the variants of the virus kept changing from Delta and Omicron and the rest. The Ghana Health Service was at its wit's end, implementing strategies fraught with lack of adherence from the populace. This resulted in the country transitioning 4 waves of the pandemic.
I don't think we regret any decision that we've taken. Lockdown is a very difficult thing to do. And that was a very difficult thing, a very difficult decision, for example, for His Excellency the President to take. But we have to.
COVID-19 claimed some lives in Ghana. Aggrieved relatives of persons who succumbed to COVID-19 were unhappy about some demands made on them before the bodies of their dead ones would be released to them.
You will send the body away. But since the money that they are demanding is too high.
Valuable specialists and healthcare workers were lost to the virus.
As we're losing very senior doctors, it put a lot of anxiety and worry in the general membership. We were very sad to lose people who were training us to this pandemic, and that in the midst of the uncertainty.
Currently, the country's total case count stands at 171,657, with 170,161 recoveries or discharge. 1,462 deaths were recorded in Ghana, and as at Friday, May 5, there are 18 active cases being managed at home. The availability of COVID-19 vaccines was going to be the game changer until the conspiracy theories against it began to manifest, resulting in vaccine hesitancy. As of April 30, Ghana has received over 35 million vaccine doses, with 32.2 million doses distributed and 2.8 million doses available in stock. Over 24.9 million vaccine doses have been administered so far. Over 13.5 million persons have received at least a dose, and 10.4 million persons being fully vaccinated. 4.4 million persons have also received booster jabs. But what does the announcement from the World Health Organization mean to the fight against the virus in Ghana?
It is not that COVID-19 is over. So you don't want to see a situation whereby cases are not going to be recorded. But all you're trying to say is that let's not focus all our attention on COVID-19, but let's mainstream it in our responses in the various countries.
According to Dr. Franklin Asiedu Bekwai, challenges, lessons and progress made has helped improve upon the country's health systems, though there are still gaps.
We have integrated our COVID-19 surveillance system into our respiratory surveillance system. So we have sentinel sites across the 16 regions. What we try to do going forward is that we're going to do genomic sequencing to see whether there will be any new variant. So we are not closing down the chapter on COVID-19. We'll also continue to monitor COVID-19 and respond appropriately when it merits that.
According to the WHO, COVID-19 continues to spread while the virus is evolving and remains a global health threat, but at a lower level of concern. It further warns countries not to let their guard down, as in most cases, pandemics truly end when the next pandemic begins. Sarah Apenkro, TV3 News, Accra.